Good morning, Hank, it's Tuesday. This video eventually discusses mental illness, but first I would like to talk to you about the disability-adjusted life year, which is very important despite having a boring name. Kinda like Bradley Cooper, but perhaps even more important. So if we're gonna figure out how to improve human health, we obviously need to know what is causing human death. Here's the global picture. IHD, aka heart disease, is by far the most common cause of death. Stroke is also very common. I was surprised to learn that diarrhea causes about as many deaths as lung cancer, but in general, this graphic looked pretty much how I expected it to. But that doesn't show us the whole picture because, of course, there is a big difference between dying at the age of 110 and dying at the age of 30, and also, dying is not the only health problem. Although it is a big one. Many diseases can be disabling even if they aren't fatal and can keep people from leading healthy and productive lives. So how do we account for all of that? Enter the Disability Adjusted Life Year, or DALY, which measures the expected years of health lost to a disease. While global causes of death look like this, global disease burden measured in terms of DALYs looks like this. Illnesses like malaria and diarrhea and pneumonia become much more prominent because they disproportionately affect younger people. One of the biggest shifts you see when you measure health in DALYs is in mental health. In fact, mental illness and substance use disorders become the single biggest category of disease burden in the United States. At least by that measure, what is still sometimes dismissed as all in your head or not an actual health problem is, in fact, our biggest health problem. And that isn't a uniquely American phenomenon either. In Brazil, for instance, mental illness is also responsible for more lost DALYs than any other single cause, including heart disease. The same is true in France and the UK. In China, depression and anxiety rob people of more years than liver